because what brought this to the forefront on social media is people were reporting on huge the loneliness epidemic for men, and saying there was a report that came out and said men are lonelier than ever. So from your research and from your perspective, is this the case, and why is it prominent in men? We already spoke about younger adults to a certain extent, but in men and also older people.
Yeah, well, men, I found it among migrant men. So I haven't worked with all men, but I think there is a duty. So what I found, because I was working with a group of men who have actually, upon their migration, had to take a job that is lower than their professional in their home
Mm.
country. So I found that many of them kept an image on social media with their family and friends back home that is different from what they actually live, and that put a lot of pressure on them in terms of maintaining this image. When they go on holidays, they have to bring a lot of gifts because they want to maintain this image as being successful, of being paid very well, and that for many was a huge burden, because that's kind of, I needed to show this image because I don't want them to feel I'm failure. I've done this degree, I've worked so hard. I don't want my father to be disheartened that I'm working on that job now, which is much lower than what I've studies and my qualification were. This is a different type of social media, so they're not speaking to the broader groups of people. They're speaking to the family and they're maintaining this image. But I would imagine that, generally speaking, there are gender differences in the way that we communicate and socialize, and women tend to be able to speak more. They are able to have small mini connections even at the grocery shop, or it is a little bit of a stereotyping, but it actually holds true in the majority of cases, that men think more about whatever connection they are making. So I wouldn't be able to speak broadly about men, why it is an avenue for them, but it's how they feel, some of them feel the responsibility and the pressure. In terms of older people, I think I spoke also about the transitions, and migration is one of those transitions. And you've talked about the third space. So if you transition from a certain way of living, your connections around you, you have built these communities, and then your work or studies or whatever reason have taken you to another place. You're completely new to that other place, and the people may not know you very well. They know you through that new framing. And if there are structural racism or a structural discrimination, you're kind of framed within that structure straight away without your knowledge. So kind of people would have a look at you, and they will, in the back of their minds, some of them would place you in a certain place in their
Mm-hmm.
head, and they would have a lot of assumptions, and assumptions are really bad, because assumptions hinders building good connections. Because if you assume certain traits or criteria about the other person, you're already framing the relationship in that sense. So there are certain groups, because of this mobility, find it difficult. Older people, particularly old, so once you pass 75, 80, you more or less, and with the increased global mobility, so people, offspring would have moved away, their grandchildren might not be around, the ability to do certain things have been reduced, so the ability to travel or to go further away. So they find themselves confined more and more into smaller spaces,
Mm-hmm.
physically, geographically, and also the opportunities that they used to do. So there are structural issues as well. So if you live in a place which does not provide these urban spaces or community-based facilities and kind of opportunities to connect with others, it will be difficult for some groups. This is where the structure and systematic issues comes in. Which groups face more barriers to be connected? That's the question. And once you try to untangle that, you try to break that down, you will see clearly that there are certain groups that needs perhaps a redesign of some of the ideas to make it easier and accessible for them, whether people have certain disabilities, physical disabilities, to access, or fear of certain things, so mental health issues, or as I said, transitioning into a new space, a new place, and they need this assurance and encouragement that they are welcomed to new space.
Absolutely. And what solutions have you seen, or I know you recommended some in your report, and I'll link that report down below, but what solutions have you seen that have been implemented really well and on, again, individual and systemic levels with the governments you've been working with?
There are loads of solutions, and it depending on the groups that you are talking about, and it can link to the other needs of the individual. So, for example, we've seen an increased need for long-term care, which is needing somebody to help you at home. In some European countries, we seen these care banks. So younger adults would do care for others, and go and visit them and see how they are doing, and then others could help their needs for care, or if they need to care for somebody, they can take on from them. So this idea of volunteering your time, of giving to the community, that it would return to you. This is more of so the intervention that we've seen, it would be organized at the community level, but it's left for the individual volunteering. A problem was that it will mean that people who have the ability to volunteer their time would be able to do it more, but people who are facing more challenges in relation to socioeconomic status or work conditions or family commitment may not be able to do that. So other interventions at the community level is to facilitate these community gathering, facilitate the work of the NGOs, help them with subsidiaries in terms of the venues that they can have, so they pay a little bit of money, not too much. Link it to other organizations so you can pool resources together and create spaces. And then there is loads around friendly communities. So we talk about age-friendly communities, but generally speaking, friendly communities and urban design and creating open spaces, which you have different things happening almost in the same space. So you can have a playground for young children, but next to it, an outdoor gym for the young people, and then a nice seating area for older adults who can come and sit down. So you kind of get people coming in with different needs, but they all want to be together around people. So what I would say, that it has to be in the minds of policymakers. So whatever you're going to do, you can create it within that. Of course, some countries have taken this issue of loneliness and social connection to the national level. So we've seen some countries have that built into their national strategy. So for example, Japan, UK, Denmark have had some national loneliness or social connection plans. We also see this included in social and public health interventions like housing, transport. So bearing in mind how to make housing accessible to people. So one of the big things that we've seen, particularly for older people, is to create housing estates that have some units which is accessible to older adults. So rather than have a community that is far away, which is only for older adults, or a care home that is far away, it's actually within the same community, but there are some units that is more accessible. So they're still within the same housing structure. They're still within the community. But to do this, you have also to think about the design of the street, where pedestrian can walk. And this is a big issue in many kind of upcoming countries, which is still facing this transition of aging, that the design, the pavement, you find very high in some places. So the design of the walkability of the city, and also transportation links. So how can you make sure that there are easy transportation links from where you live to where the community exists because people are scattered, but there are centers where people can gather, and creating these more smaller local points of gathering. So you have to have like a spot, a green spot, or somewhere which has shelter. So you need to think, okay, older people might want to sit down and have a shelter. Younger people would need some space to play around, and children would need something to play with. So you have to think about all this combination together. And of course, you need bathrooms and loos, and this is a big problem in many countries, that you have to have
Mhm.
facilities for people to sit down for a couple of hours, or for at least for an hour, 1 hour, and you can have the facility. So that's really important to think about the structure of the policies coming from high level hierarchical to the individuals.